Hello, I'm Dr. Shireen again with another reel in our series on keeping your breasts healthy and beautiful. So today I thought we'd talk about breast implants. A lot of ladies are choosing to have implants to enhance their appearance, and there are lots of questions that they ask. One question is, do breast implants cause cancer? No, they do not. Can I breastfeed with breast implants? Of course you can. You can breastfeed as much as you like with breast implants. It doesn't affect the flow of milk. Another question I get asked, will mammograms damage my implants? And I'll say this in a very cheeky way, ladies, the implants are made to be squeezed. That's what they're made to be happening to them, to be squeezed. Mammograms do not harm the implants. The type of trauma that hurts implants is sudden, forceful impact, like falling onto a hard surface or a hard object slamming into your breast implants. That type of trauma will hurt your breast implants, but not a mammogram. I just want to emphasize that when you have implants, ask your doctor to refer you for, if you're 40 years and over, for a mammogram and ultrasound, because the implant does obscure parts of your breast, and so you need the ultrasound to sort of look around the edges of the implants and get a better look at the breast. So he needs to request both. I want to add that before you have your implants put in, I would like you to ask your plastic surgeon to request that you get breast imaging to make sure your breasts are healthy before you get the implants in. So if you're under 40, he can refer you for breast ultrasound. If you're 40 and over, for mammogram and ultrasound, because it's an expensive operation to put in implants, and you want to make sure your breasts are okay and healthy, and there's going to be no problem after you have the implants. Okay, so I want to show you an example of mammograms with implants. So these are the implants, the white bits, and the breast tissues around it. So what our mammographer does is displaces the breast tissue a little bit forward. You can see here the implant displaced views, and you can see a lot more of the breast tissue on the mammogram. So you get beautiful looking, you're able to image the breast beautifully with your breast implants. And here's the reason why we want ultrasound as well, because we can have a look at the implants, which the mammogram doesn't show you. So here we have the same patient on ultrasound. If you look at this picture, she's got a rupture of her right breast implant, or this white hazy appearance. Here is the silicone that's out of the implant capsule, which does not show on the mammogram. So that's the other reason that we should do ultrasound as well, is that we can see if there's any implant rupture. So I hope I've answered some of your questions about implants, and I will look forward to our next reel, which will be dense breasts. So we'll talk about dense breasts, and any questions that you might have, please put them in the comments and I'll be happy to answer them. Thank you.